To get things started, I do again just want to say thank you for being here to have this important conversation with me, with all of us. It is an honor to be in the room with so many high profile and impactful people, but it's also a joy to be able to sit down and to talk about a subject that can be very difficult, but is also so necessary to talk about, and that is maternal health, and specifically Black maternal health. As we talked about earlier, the reason I reached out to all of you individually is because I've either had conversations with you or I've seen work that you've done in the community and how important this particular subject is to all of you. Many viewers know my story. A lot of you have heard my personal story with maternal health, losing my son, but also even before that, difficulties in having my daughter and hemorrhaging and nearly losing my own life. And we're talking at a major hospital system in Central Ohio. And the fact that I had access to healthcare, I had regular checkups, I had continual monitoring of my own personal health situations, and this still happened. I know all of you have your own stories like that. And so I just kind of want to get your idea initially of where you think things currently stand, maybe why you wanted to even be a part of this conversation.
So first off, thank you for convening us together. There's no cap on the frequency we should be having these conversations, so I appreciate that. I'm here as a person who has been in this work for many years, but also as a person who's lived this, as a Black woman who has had experiences with just trauma in childbirth. And so I bring all of that to my day-to-day work into these types of conversations. As far as where we are at a place that has tremendous disparity in this issue. And so I think we're at the turning point of a time when we can start talking about it. We can start definitely sharing what that disparity is, what is driving it, how we can turn this ship around.
Mm-hmm. Absolutely. Dr. Roberts, I appreciate you being here. Obviously, you have a wealth of knowledge when it comes to the status of, like Danielle mentioned, disparities when it comes to the health of Black people in Franklin County specifically. But what interested you in joining this conversation about maternal health?
Sure. So as a physician and as the health commissioner here in Columbus, I have seen firsthand the data that talks about the disparities and the losses that our community has suffered because of maternal issues as well as infant issues. And I went into public health because I wanted to help the broader community versus just one patient at a time if I were in private practice. And I feel like it is my calling and my duty to do whatever I can from a programmatic perspective, from an educational perspective, to inform the general public, but most importantly, the women and women of color of these issues so they can go into those pregnancies with the knowledge and know what resources are available in our community to assist them and their families.
Absolutely. And of course, we have two council members here today. I was at the council meeting when you wanted to put a specific focus on Black maternal health and having an entire week to recognize and bring awareness to that specifically. Why is that?
And I want to first also echo my appreciation for you hosting this conversation. When I think about the state of where we're at right now, I think about the state that we live in, and that's Ohio. And the reality is that Ohio ranks 7th in this country for highest infant mortality rates. And that is a sin and a shame when we think about the fact that we passed Issue 1 last year, cementing reproductive health care in our community, and the way in which women and men rallied around the state to make sure that our right to choose in this state could be solidified indefinitely, but then also thinking about the realities of systemic racism. the complex interaction of policies and procedures, laws and institutions that do result in disparities. And this is a disparity. When we think about the fact that Black women and Black babies are dying because of medical racism, right? And so I wanted to make sure that as a member of council, but also as a member of the African American community, someone who has had her own experiences in this arena, could give voice to those who unfortunately would not have the opportunity to speak up for themselves.
Absolutely. And Councilmember Bankston, I was at that meeting, as I mentioned, and you shared very personally that you and your wife had an experience with, I believe, a misdiagnosis. So I can only imagine from a male perspective what that looked like, what that felt like, and why you agreed to join in on this conversation.
Yeah, I mean, I agreed to join in on this conversation. I'm glad that I'm here because I think when we think about maternal health, we only think about mom. And really dad and the entire support system around mom has a role to play in her health. And it was a misdiagnosis. It was also this rushing of always trying to get to a C-section or always trying to induce labor. And what we found out through having that knowledge and being knowledgeable, you know, my wife in the thick of it, right, is thinking about one thing only, and that's trying to make sure that she's pushing or doing what she needs to do for the baby. And so to be that support for her to say, take a second and let's re-examine this is something that my role is, right? And so men have a voice in this because at the end of the day, we're talking about family unit. As council member alluded to, when we talk about issue 1 and abortion rights, these are women's issues and women's healthcare issues, but men need to support women in making those decisions. And so for me, and anytime I can lend my voice and encourage other men to do it, I'm happy to. And in this particular case, sitting as a council member, we think about the women and our community holistically because we know that infant mortality and maternal health is about the social determinants of health. It is about the environments that these women go home to. And so that's our role that we have to do. But here today on this couch, I'm proud to be not just a council member, but dad to Xavier Kamal Bankston and wife to Habiba Bankston, our executive director at Dress for Success. And so happy to join the conversation and looking forward to it.
And I'm so glad you mentioned that support system, right, and that male perspective. That was a conversation I had a lot with my husband, and how traumatizing, quite frankly, it was for him to see what I was going through, even in the process of labor, but also after the fact and postpartum, and how difficult that was. But that support system, that holistic approach, which is why I wanted to bring in Jatu. And we've had some conversations about the fact that delivery, pregnancy, it looks very different for every woman. And it's important to approach that very differently for every woman, would you say?
Absolutely, definitely. And for me, you know, and thank you for bringing us all together. One of the biggest reasons that I decided to be here today is because for me, making the changes from the inside out are really, really important to me. Being able to sort of be a part of a large hospital system and see what's going on in that hospital system and make plans on how to combat it from the inside out is extremely important to me, and that's why I'm doing what I'm doing.
I appreciate what each of you are doing in your own separate spaces, but also collaboratively to make those changes. And what is it that needs to change? What are those things that we really need to focus on in order to see improvements and hopefully see those numbers change? Whoever wants to dive into that one.
Well, I think it starts with education. And for me, you know, I think everything starts with education. And my prayer is that when you know better, you do better. And so I think that unfortunately there is a delta between the information that people know and what they don't know, right? And for many members in our community, they don't know that this is actually a problem. You know, I'm going to give a shout out to Mayor Ginther in the city of Columbus, who has championed Celebrate One, and we have our director here that has done a phenomenal job thus far. But the whole reason that Celebrate One exists is because of this very conversation that we are talking about here today, and yet and still there is still a disconnect between those champions that could come on board and help to really drive this mission home. It takes education, it takes dollars, and folks who are willing to raise awareness. But then on the other side, it's the education that happens in our hospital systems, that happens in medical school, and how are we preparing the doctors of tomorrow to provide care that is individualized, that is not based upon their own biases, whether they're perceived or not, so that they can confront those issues and be able to provide the best care to the person that is sitting in front of them. I have been on the receiving end of those perceived biases far too often, to not be able to sit here in front of you today and say that medical racism absolutely exists, right? And I know that the care that I would have received had my skin color been different would have been different, right? And I could have a different result sitting before you today. And so it's important for everybody that's on this couch and those who are watching to educate themselves and figure out what they can do to change these disparities in our community.
I just wanted to piggyback on that because you mentioned the collaboration and connection that needs to happen. And so certainly education is important, but a pregnant family encounters so many different systems and so many different pathways throughout the course of their pregnancy. And those pathways are largely unconnected to one another. And so there are many opportunities for families to fall in between the cracks of each system. And so really our goal at Celebrate One is to bring that collegiality and bring that collaboration and that connection between those systems so that there's a smooth transition for families from conception through delivery and beyond.
Yeah, absolutely.
And I'll just say too, I think conversations like this are important because you can't address something that you don't discuss. And having the dialogue, I think, is a huge step. And many folks see that as inaction. But really, we have to have a dialogue around this because it is not a silver bullet. It is a system that we're talking about, and it's a holistic approach that we have to address when trying to tackle it. But one of the biggest things I know I can say is how do we get families the resources that they need, that they feel empowered to ask questions, empowered to challenge, empowered to really make those decisions for themselves. You know, our medical industry, and you think about other industries like fire and police, these are all industries where we give authority and we trust those folks because they are the experts, they're smarter than us. And so there's this fear sometimes to question what they're saying, or there's this fear to not ask any questions because I don't know, I'm not a doctor, right?
Right.
And so, but if we can, I think, rip that veil and make that process really a process where doctors and the system is working hand in hand with families to make sure that they have the outcome that they want to see, then I think we'll see better outcomes. And so at the end of the day, I think it's empowering families, empowering women, but more importantly, listening to women. Women know their bodies. Women know what is going on. And so we have to make sure that we have a system, regardless of healthcare, all across the board, where we are listening to women and what they need.
And I would echo what everyone said, but just emphasize that this is not a silver bullet. You know, this is a multifaceted approach, that we do need the education. We need strong providers that understand there is medical racism, but there is racism in our community. And what we have to realize and address is how that racism impacts people, their jobs, which affects their income, their housing, the education they get from pre-K to kindergarten on up, the knowledge they get about reproductive care, how you get pregnant. I mean, we have youth today who are having sex who don't even understand the basics of what sex does and how that can impregnate somebody. So it's really multifaceted, and the social determinants of health, the healthcare system, empowering people, having support during a pregnancy, like with doulas. I think that's really important, and we don't talk about that enough. And you know, what we're seeing, particularly with maternal health, is something that has been going on for years, unfortunately. My paternal grandmother died in childbirth. That was accepted in some ways back in the early 1900s, right? Particularly if you were of color, because you couldn't give birth in a hospital. But now, because of social media, we have celebrities and famous people sharing their stories and bringing voice to what some of us have known has been happening kind of underneath the surface for many, many years. And I appreciate them bringing that story to light so that we can sit here and others can talk about it, and hopefully we can prevent the next one from happening.
So many incredible things that all of you just added to that, and so many points that I really want to elaborate on. The fact that doula services it's so different than what many of us were taught growing up. That initially you heard, oh, that's just for like people who are all the way out here, and you need to be in a hospital and you need to have a doctor. But I think we've almost kind of seen this switch where it has become, like you said, with social media, it's become a lot more accepted, but you also see the positive impact that having somebody who can vocally support you and to be that voice where we may be too intimidated to question a doctor or what they think is best for us, to have somebody stand right beside us and say, I know you as the person, not just as a patient. Would you agree with that at all?
Absolutely, and I'm going to echo what everyone said. I think, not to shameless plug, but our tagline at Moby Nurses is engage, educate, and empower, in that order, because for the exact same reason that everybody just mentioned, education leads to empowerment. There are so many people, one, who don't even know what perinatal support is and how important it is. They don't know their risk factors. They don't know going into a pregnancy, going into the hospital to give birth, they don't know their risks. And so having that support from the very beginning, leading up to the birth, is so, so important. And then also having that support postpartum, because a lot of times that's where bad things happen. People don't realize that. Having that support throughout the entire pregnancy and that wraparound support from a doula or from a perinatal support advocate is so, so important, and it can save lives.
It was a game changer for our family. Jessica Roach with Root Restoring Our Own Through Transformation was our doula, and it was the healthiest that Habiba had ever been. If you look at all her charts, because she came up with a nutrition plan for her, stayed on top of her, even post, when we looked at her numbers, she was still the healthiest that she had ever been. And my wife suffers from sickle cell, so it's already a higher risk pregnancy. And I think empowering us with the information that was needed. Jessica even also forced me to go to the doctor. It had been almost well too long before I had even went and had my physical. And she said, well, you're not moving forward until you go get your physical too. So it's about the whole entire family's health, and having those doula services absolutely gave me the empowerment in that room when they wanted to induce Habiba's pregnancy, but every time she had a contraction, Xavier's heart rate would drop to almost zero. And so because of what we had learned, and we knew we had a birth plan and all the things that we had been coached throughout the process, it clicked in my head that, well, if we induce, that's going to make contractions much more frequent and much more intense, therefore making his heart rate drop even more. And so I said, no, we're not going to do that. And I felt empowered in that moment, right, to say that. And that was a nurse who was recommending it. Then when the doctor came in, he was like, no, you were absolutely right.
Wow.
And I wouldn't have even suggested that.
But because you were there through the process and you had that education, you felt empowered to say, I am aware of what's happening and I feel good about moving in this direction.
Absolutely, and they were there posts for us too, right? And it's not a silver bullet, but it's one tool in the toolbox that we have to make sure that we look at.
I think there's I think there's a misconception also about doulas coming into the birthing space and sort of taking over. That's not the case at all. A doula is there to empower the client to speak up for themselves. And that's what's so important. A lot of patients, clients, they don't even know that they can say no to something as simple as, we want to induce you, for whatever the case may be. We had a client that was having it was our first client, she was having her 6th baby. She knew her body. Yeah. She knew when she was going to go into labor, and she truly did. She knew up to the date when she was going to go into labor, and that's what happened. Her doctors wanted to induce her for her blood pressures. Her blood pressures were only high in the office. Me and my doulas even went back and forth because I'm on the clinical side, they're on this side, and we sort of had a back and forth, but at the end of the day, we educated her. We let her know this is everything. Here is the story, here's the clinical picture, you make your decision. and she made her decision, and she did not go for her induction. Her water broke, and she had the birth that she wanted.
Wow.
So that's what a doula in and of itself, like that's what it does. It empowers the patient to make their own decisions and to do what they think is best for their body because they know.
I just wanted to add to this that doulas are an incredibly important part of a portfolio of caregivers during a pregnancy. But one of the providers that often gets lost in the conversation are midwives and midwifery care. And midwifery care really does have an impact on outcomes. We see it abroad, and we can see it here at home. And so looking at how we develop a strong portfolio of birthing workers in the workforce is a really important part of wrapping ourselves around this issue. So that spans from doulas, that means midwives, that means labor and delivery nurses, and anyone that comes in contact with that birthing family needs to be able to relate to that birthing family. And so I think we have a responsibility, and it certainly falls within Celebrate One's responsibility to build the portfolio of birth workers in Central Ohio.
So how do we make this happen? How do we make this accessible for people who may not have the means, or that they say that's just too much. There's no possible way for me to be able to even get to these appointments. And how do we make that tangible for them?
I mean, you show me your budget and you show me your priorities. And I think the city of Columbus has been intentional in, first of all, recognizing that there is a disparity to access to resources, whether that be the actual care that could come from midwifery or from doula care, or just being able to have transportation. One thing I'll even toss out there too is the connection between infant and maternal health and access to housing, safe and affordable housing, and how there is absolutely a connection to whether or not that baby will survive and that mother will deliver if she has a safe roof over her head. But despite that, and we at Council have been intentional about supporting doula work for the last 3 years now. Obviously, we have a line item that supports Celebrate One and all of the resources that it does to support the women in the city of Columbus. And so it has to start there. I mean, the reality is that it does take dollars to raise awareness and connect people to whatever resources that they need to support a healthy pregnancy.
And I'll say too that I think it's going to take all of us, right? I think the city is stepping up in a major way, but the issues that we're talking about with maternal health and infant mortality, these are national and state issues. And so we need our national legislators to be looking at this. We need our state legislators and state governments also, because they hold a much larger stick, right, with hospital systems than we do. But we're going to do our part here on the ground, on the local level, being led by this amazing team to the right of me. But it's going to take state, federal, community, grassroots, everyone stacking hands and saying, how do we address this and how do we remove the barriers, whatever they may be, to make sure we have healthy outcomes? And
I want to just hit on that a little bit more because Congresswoman out of the state of Illinois, as well as VP Harris, have as of lately talked about the reality of fibroids, and particularly how they have impacted Black women. And if we're having a conversation about maternal health, one thing that does get left to the side is women who have, for various reasons, suffer through infertility, right? And how that plays right into the hands of maternal health care. And so without that, the reality of having a national conversation where there are studies being done that can start to pick apart why these issues do trend heavily for Black women and folks of color, we're really not getting to the heart of some of these issues. So absolutely medical racism exists, but there also has to be more dollars and research done into truly picking apart what is happening with maternal health care just in general in this country.
Even prenatal.
Correct.
Even prenatal.
Yeah.
And I will say, both Director Tong and I have the opportunity to work with our 4 hospital systems here. And I will say the leadership and probably many of the staff at those facilities are aware of these challenges and the data, and they want to do better. And they are putting things in place to provide education, to provide resources for their staff as well as their patients. But these things don't change overnight. It takes time, and it takes years and years of putting work and effort into it. When Celebrate One started over 10 years ago, I think we were really good here in Central Ohio about having one entry point, one open door, for pregnant women to go through and to get an appointment and to get all the services, home visiting. And as we've gotten better with that, and as the pandemic happened, I think we've seen a shift in how we utilize some of those resources. And we're realizing that by not having this centralized intake process, we might be missing some women, and so we've got to go back to basics. And Director Tong and I have been talking to our 4 hospital systems about how we see an improvement, and so that we can get back to that. But it still doesn't necessarily, that one door invitation or phone number doesn't address this medical racism that Councilmember Favor has mentioned and others have mentioned. And I see it not only in maternal health, I see it in other issues. And so I think we have to do better at deciding who gets into medical school. We need more people of color going into medical school. And I'm really proud. I'm going to give a shout out to my friend Dr. Laura S.B. Bell, who has her Made for Medicine program. They're really trying to get more minorities into medical school. But then once we get those kids to medical school, we've got to educate everyone about how to treat people as a whole and not based on the color of their skin.
I think that's so important, and I've experienced that personally with my own pregnancies, and not even just with racism, but what I would call just prejudice, and the fact that I was in my 20s when I first started having kids, and I was considered to be fit. So you can't possibly have any underlying issues. You can't possibly have any problems with your pregnancies. Well, I did. Even though I fit the prototype of what a normal, healthy young woman looked like, I still nearly lost my life having children because I had issues that weren't addressed.
And that's why this dialogue is so important, because when you look at the data, it's not a direct correlation. It's not about education. It's not about income. The one factor that continues to be consistent is skin color, right? And so I'm just glad that you raised that, because many folks think that because you have more income or privilege, or you have a better paying job, or you have better health care, that would change the outcome. But what we're seeing time and time again, especially when it comes to Black maternal numbers and Black infant deaths, it doesn't matter what zip code you come from or what your background is, that this is something that is an epidemic in our community that has to be addressed, and there has to be national conversations, state conversations, and dialogues like we're having today to shed light on it.
Well, and then sometimes it's not just the care you're receiving, right? We know, and we have data to support it nationally as well as locally, that women of color, particularly African American women, are more likely to have a miscarriage. And so it has an early miscarriage. So it has nothing to do with, the poor medical care or the discriminatory medical care that you may or may not have received. It's just our bodies. And our bodies as women of color, no matter what our income, no matter what our title is, have had a great deal of stress that has come onto us just because being a woman of color. And that unfortunately can exacerbate our ability to carry a baby to full term. And we've seen that. And we have seen, Harvard educated women, well paid, great insurance, miscarry at 10 weeks, at 15 weeks, at 20 weeks. And it really is just this long-standing stress that they've had on their body. And they've had studies that shown, their cortisol levels are up, all of their stress reactors are up compared to women of their same age and same neighborhood.
Well, and I'd like to add to that as well that one of the things that I see is that we're talking about racism, and we're talking about medical racism as something that exists. And we're also talking about multiple systems. So families who are pregnant are experiencing systems that are not just medical. They're experiencing, judicial systems, housing systems, the job. They're experiencing all sorts of systems, and inside of each one of those, racism shows up differently. And so what you wind up needing for a person to have a successful birth is for all of these to align. And that's why the coordination of all of these different systems is so important, because you experience stress from your work environment, you experience medical racism, you might have housing issues and be more inclined to be evicted based on your skin color, and you're experiencing them all at the same time. And so our responsibility as workers in this field and as advocates is to force alignment and to find that racism and the way that it shows up across all of the systems that our families encounter, root it out and align us to a place that has an environment that's healthy for families to develop.
Well, and I would also say, Director Tong, our role, particularly yours and mine, is to provide, that wraparound service, and so that the patient, the client, doesn't have to navigate the system alone. So that's why we have case managers, that's why we have navigators to help them, because it can be challenging to figure out, to know where to go, to know what you need, to know what office you show up at, to know what form you fill out, how do you get this bus pass, how do you do this? And so we have, given that responsibility to ourselves to help pregnant women here in Columbus and Franklin County try to navigate that system, because many women and families in our community need that extra support. And so it's not only, recognizing that there's multiple players that individuals have to work with, but how can we streamline that process for them?
I also think Celebrate One has a responsibility, in addition to that, to support that alignment. So we have community health workers that work with Celebrate One, and we help families navigate the systems that we just talked about. But we also have a responsibility to helping support in the housing area as well. We have a responsibility to helping folks navigate their workforce development, which we see a lot in housing as a compounding issue. And so for us, getting to that social determinant, getting to those social determinants of health is an equal part of supporting the person through what is largely a system that is stacked against them, and helping to create a system that works for all people.
You gotta jump in. You gotta jump in. You gotta jump in.
Well, I love the passion, and I love that each of you have something to contribute that's impactful and important to say.
So the educator in me wants to clarify. I think when we talk about medical racism, people automatically assume that means my doctor is racist or my nurse is racist. It's a system that we're talking about. We're talking about an entire medical system that was built on racism. We can't scurry away from that fact. It is what it is. And we have to talk about how healthcare systems, specifically the 4 in Central Ohio, take accountability for that. When we think about health equity and the DEI departments in hospitals, what are these departments doing to ensure that our health equity plans are tangible, that they name names and responsible parties for the work that needs to be done, and then actually go ahead and tackle that work? The accountability is everything, because if we're continuing to talk about it and we're not taking the action, we're not going to go anywhere.
And I think the problem is that, many of these words that we're using have become boogie words once again, right? They're buzzwords that have been weaponized to really diminish the impact of what we all know to be true. And the reality is that we cannot operate in this idealistic society, post-racial, thinking that these things don't matter anymore. I don't see skin color. The proof is in the pudding, right? the five of us would not be sitting on these couches right now had we not personally experienced this, had we not had family members that have encountered this, that the data did not reflect, not just in the city of Columbus, but in the state of Ohio, that this is a problem that requires not just legislators, but we need scientists and we need doctors and nurses, and we need folks with dollars and people who care about the livelihood of this state and this city and this country to pay attention to what's happening to Black families.
And I know we've talked about medical racism, we've talked about racism, we've talked about empowering individuals when they're at healthcare, but I would also say, I don't want people to hear this or listen to this and think, well, the issues are so far above me that there's nothing I can do as an individual, whether I'm thinking about getting pregnant, whether I'm a soon-to-be grandmother. I would say what we need to do, particularly people of color, particularly Black people, because we do this well, is we need to talk. And that is something I think we don't talk enough about. We don't share our stories. So, Jennifer, I really appreciate you sharing your story because I know it touched a lot of families by you being honest with your experience. But I think all of us need to do that, whether it's maternal health issues, or infant health issues, or any other issues. We need to share our stories because people learn from others. That's how we learn. That's how we in the Black community learn, And so we need to be open and transparent when appropriate about our stories so that others hopefully don't have to go through that same thing. And if they do, they know that they have someone there who can support them and guide them and tell them their experience.
And the hope is that those conversations don't start at age 40, right?
Correct.
That we are having these conversations early enough that folks can catch when problems are starting to perk up. And that we can connect them to whatever resources they need to mitigate whatever it is so that they can live out whatever their dream is, whether it's to have a family or just to live a great solo life, right? But the reality is that we don't talk enough in our community, especially about the hard things, about the personal things. And these issues are deeply personal, right? But we are in this work of public service to make sure that not one other person has to live our story or have the same experience as us, that they can have a better experience and go on to do whatever they would like to do in this lifetime.
Absolutely.
So thank you for first catalyzing this conversation, for getting us here to talk about this.
I'm so appreciative to you all for agreeing to that. And actually, that's exactly where I was going to say, I could keep you here all day and just talk about this because it is that important. But you're right, we have to talk. And that's what this conversation and the grander conversation is all about. Talking about the really hard stuff, but giving you that door, kind of saying, here's how you can start. And it doesn't have to be long and drawn out. It doesn't have to be a series of conversations. It just starts by starting. Just speak to someone about these really tough issues, because we're not going to see that big change until it starts, like you said, on the ground level. And if we can start here and over the next few years hopefully see some big changes for our community, then I think we've done our jobs and hopefully have made a big difference for the people where we live. So thank you all so much for being here and for being part of this. And I think we're going to have some more in-depth, maybe more personal one-on-one conversations down the road, because people do need to hear our stories.
They do.
They need to know that our story may be what their story is, or vice versa, and that they are not alone in this. So I really appreciate all of you being here and sharing with me today.
Thank you.
Thanks for having us.